Very quickly, I just want to touch on a few key investment highlights. We compete now in some very large markets. In fact, almost $3 billion is the addressable markets in which we compete, both in the cancer space and in the largest healthcare market in the world, heart failure. You'll see from a couple studies today that we now have a product that can be a significant disruptor, especially in the heart failure space. We have a device today that's hundreds of dollars that can now compete with a device that costs more than $20,000 and is a $20,000 to $30,000 procedural cost in the heart failure space. We've cleared all of our regulatory hurdles. So from an FDA and CE mark perspective, we now have full clearance. We're working on reimbursement, and we should have that shortly. As Scott said, we've gone to a new SaaS model. So in the last several months since we've rolled out our new model from capital equipment to software as a service, we've signed up more than $4 million in contracts. And right now we have $3.5 million in future business already booked. So we've had a significant change to our business. We booked $1.9 million this quarter, or the last quarter alone, for our business. Our new device is a complete change from our older device. You can see a patient just stands on the device, bare feet, hands, place their hands on it, and the amount of information we're able to provide a clinician is significant. We can provide them an update on their cancer care, on their heart failure status, on their nutritional aspects, all the way to bone density. So it is a significant change for our product. Two big markets. Cancer survivorship is $1.8 billion. It is a massive opportunity for the company, and heart failure at a minimum is $1 billion to $2 billion. A couple quick things here. We just had a major study come out in the United States, so now we have almost 1,500 patients in independent studies showing that our device can reduce lymphedema or eliminate it in 82% of the cases. Lymphedema occurs after your cancer treatment. 1 in 3 cancer survivors will develop a permanent swelling of an arm or leg, or both arms or both legs, due to their procedures. Our device can reduce that by over 80%. PREVENT trial. This is a 5-year study we've been undertaking. It is considered the highest level of evidence. This trial alone, we reported interim results on 500 of 1,100 patients after the first year. And in this instance, we had a 67% reduction. Now, lymphedema in the first year will present itself in 50% of the cases, and in the following years, it'll continue to decrease. I'm going to go to heart failure now. Heart failure is an interesting opportunity for the company. Heart failure is brought on by the heart's inability to effectively pump fluid throughout the body. So it's all about fluid overload. Our ability to detect small fluid shifts, we just proved with 2 trials. This trial showed a correlation of almost 90% to an implantable device. So that's a device that's permanently implanted in your pulmonary artery, and it checks for fluid, and they monitor that fluid on a daily basis and are able to adjust your medications. You can see in this example here that the blue line is our device tracking small fluid shifts. So again, you've got a $60,000 medical device that's monitored daily versus our device, which is hundreds of dollars. It is a huge opportunity for the company. The other test just showed versus an echocardiograph. So this is just an echo of the heart, and our correlation to that was almost 77%. So we've got some significant technology breakthroughs. These are small studies. We believe that in the future, though, that we're going to be able to make an impact here. We're going into our final studies. So let me walk you through a couple quick action plans on what you can expect to see from us. First of all, the PREVENT trial is going through peer review process now. That should be published in the coming months. With that, we can go to the private payers, and in the United States, about half the patients are in private pay, half the patients are in the federal program. We already have the federal program paying. We just need to get the private payers. They needed a level 1 evidence study. We now have that study. We feel confident that we have a very strong case for them. And the guidelines, cancer guidelines in the United States, if you get the cancer guidelines, every private pay has agreed to pay. We have a very strong case to make before them as well. We feel very confident that we will overturn this shortly. On the heart failure side, you just saw the new data. That data is being presented this weekend at the World Congress of Cardiology. We think it's going to make a significant splash because if you've got a small device, inexpensive, that is as good as an implantable, we believe there's going to be a lot of interest in that. We will start a follow-up study to that to be able to get the clinical data necessary to go into the market, but understand today we have FDA clearance that allows us to monitor heart failure patients. We're currently monitoring patients at home, where most heart failure patients are monitored on a daily basis. So we're very excited about this new opportunity for the company. So we've got quite a bit of news flows coming out over the next 6 months.